Bipolar disorder is not just mood swings. People throw the word bipolar around casually now. Someone gets angry, she's bipolar. Someone changes their mind, he's bipolar. That is not what bipolar disorder is. Bipolar disorder is a serious psychiatric condition involving episodes of depression and episodes of elevated mood states like mania or hypomania. This episode affects sleep, judgment, energy levels, behaviors, relationships, finances, work, and sometimes reality testing itself. One of the biggest reasons bipolar disorder gets missed is because many people only recognize the depression part, not the mania, not the hypomania, not the impulsivity, not the decreased need for sleep, not the sudden grand ideas, and not the risky behavior. Some patients actually present during depressive episode and are diagnosed with major depressive disorder for years before anyone realizes they also had periods of elevated mood. That matters because treatment can completely change depending on the diagnosis. For example, giving antidepressants alone to some bipolar patient can potentially worsen mood instability or contribute to manic switching in vulnerable individuals. And mania is not always happy. That's another misconception. Some manic episodes look euphoric, others look irritable, agitated, aggressive, impulsive, or chaotic. A person may suddenly sleep 2 hours and still feel energized. Start multiple businesses at once. Spend thousands of dollars impulsively. Become hypersexual. Speak rapidly. Feel unusually powerful or invisible. Become extremely distracted. And in some cases, develop grandiose beliefs. In severe cases, psychosis can occur. Bipolar disorder is also highly associated with suicide risk, substance use, occupational impairment, and relationship instability when untreated. But this is what people also need to know. Bipolar disorder is treatable. Many patients live stable, functional, and successful lives with proper diagnosis, medication adherence, psychotherapy, sleep regulation, trigger awareness, structured routine, early symptom recognition. And that sleep part is extremely important. Research consistently shows disruption in circadian rhythm and sleep patterns can trigger mood episode in bipolar disorder. So no, bipolar disorder is not just being emotional. It is a complex mood disorder involving biological, psychological, behavioral, and environmental factors. And reducing it to a personality trait is one of the reasons many patients suffer silently for years before getting properly diagnosed. If you work in mental health, educate carefully. If you live with bipolar disorder, learn your patterns. And if you know someone with bipolar disorder, understand this. Feeling stable does not mean you have lost yourself. It may mean your treatment is helping. I hope you've learned something new today. Please engage on this post, like, comment, and repost. Thank you.